Yeah, so when folks are interested in a consultation, they can reach out through the website, they can call us, get you set up, and then bring you in, get some pictures. We kind of go through your own pictures. Sometimes we just look in the mirror, whatever, to really sort out what someone is seeing. Sometimes people will bring in pictures of themselves in different social settings where they're seeing the issue, like, hey, in this lighting, this is where I see it. And so those are kind of ways that they can relay what they're worried about. Then I try to go through all the non-surgical and surgical options, whatever's most appropriate. And sometimes a combination is the best course of action. And then we talk about what the procedure is like, what the expected outcomes might be, but also, we go through what the risks are so that they feel like they've really got their mind around what they're maybe stepping into and what the recovery might be. And then we look at some before and after photos of patients on TouchMD. We look at some diagrams often, and then once all the questions are answered and the patient feels comfortable with it, then as we get to the point where maybe surgery is scheduled, I see everybody again in a pre-op visit, at which point I encourage everybody to bring in any list of questions they have, again, to make sure that they've got their nest set up for them to tuck themselves into when they get home, and send off their prescriptions ahead of time, and just try to make sure that everything is set so that on the day of surgery they come in and they're feeling as comfortable, as ready, as excited as they can be. So on our website, portlandplasticsurgerygroup.com, we have a photo gallery. Our Instagram, we post regularly photos, and then certainly during consultations, I go through photos. Sometimes folks aren't comfortable having their facial photos on the internet, but they've given permission to show in a more intimate type setting.